Welcome to the HHA Pepper 102 webinar presented by the Visiting Nurse Associations of America. Kimberly Hrehor is a director with TMF Health Quality Institute. She manages a contract with CMS to develop, produce, and distribute the Program for Evaluating Payment Patterns Electronic Report, PEPR, for hospitals and other healthcare providers. She develops training and reference materials to help providers understand and use PEPR. Kim's work experience includes health information management, compliance, and performance improvement. I would now like to turn the presentation over to Kim. Kim?
Thank you so much, Heather, for that very nice introduction. Again, my name is Kim Hrehor, and I do work for TMF Health Quality Institute. And we are contracted with CMS, or the Centers for Medicare and Medicaid Services, to produce the PEPRs that we make available to a number of different types of providers. So today, I'm really pleased that I'm able to come back and share with you more information for home health agencies in particular that can help you not only use your PEPR, but also understand how the data are put together and some other resources that are available for you outside of your PEPR. Now, for those of you who were participating or listening in to the session that I presented on August the 17th, at that time, you may remember that we walked through a home health PEPR, talked about all of the different target areas in the PEPR, why they were included, and that type of thing. Today, I plan to build off of that session and review these additional resources that are publicly available through our website. We have available national and state level data, as well as peer group bar charts and some other information that you may find helpful. And then at the end, we should have ample time for questions and answers. Now, I did want to just have a couple of slides here for those who maybe didn't make the August 17th session and are curious as to what the PEPR is. So the PEPR is an acronym. It stands for Program for Evaluating Payment Patterns Electronic Report. And essentially what the PEPR is, it is a Microsoft Excel workbook that summarizes one home health agency's Medicare claims data statistics for these areas that we call target areas. And for your reference, I did include a listing of those risk areas on the very last slide of the handout in today's presentation. So in the PEPR, your statistics are summarized in these 6 areas and compared with aggregate statistics for all of the home health agencies in 3 different comparison groups. That would be in the nation, in the Medicare Administrative Contractor or MAC jurisdiction, and in the state. And in the PEPR, we use these comparisons to identify when your agency might be at higher risk for improper Medicare payments, meaning that its billing practices look fairly different from the majority of the other agencies in any of those comparison groups. So why might you want to be interested in PEPR? And this is also a repeat slide from my August presentation. Well, all of us know that in this age of focus on waste and abuse in the federal government with federal funds, providers in particular are under increased scrutiny, and that has really moved to focus on the post-acute care providers, home health agencies included. So we know this by looking at the Office of Inspector General work plan, which they put out on an annual basis. We know that there are a number of contractors that would include recovery auditors, the Medicare Administrative Contractors, supplemental medical review, and so on, who are sifting through claims data for the providers within their jurisdictions or regions and looking for opportunities to reduce and prevent improper Medicare payments. We also know that according to the CERT report, an annual report that measures the improper Medicare payments, the home health agency error rate did increase from 51% to 59% in 2015. That's projected $10 billion in error. I'm awaiting the new CERT report to come out any day now to see how that payment error rate might have changed. Another reason that I'm including this slide is that in October, the end of October, there's a newsletter that I subscribed to, and it had a very interesting article in there that was titled DOJ, Data Analytics Are Giving Enforcers an Edge in Identifying Billing Outliers. And the article described the way that the Department of Justice is using Medicare claims data to supplement their other data mining and analytical activities to identify the providers that may be at highest risk for improper Medicare payments. And while they're looking at, the extremes, like providers at the 99th percentile, I think it's very important for all of us to understand and have a handle on how our statistics compare to all of the other providers in the nation, and whether those billing statistics might identify us as at higher risk. So then, first of all, you can be aware of that, and second of all, you can take a closer look if something doesn't look right within your statistics, within your PEPR. So today I'm going to move on now, and I'm going to talk a little bit about the national level and state level data that we have available on our website. So within your PEPR, that summarizes your individual provider's statistics, and we compare them to the 80th percentile for the nation, the MAC jurisdiction, and the state. But we also have available aggregate data reports for these 6 risk areas, as well as for those top reports included in your PEPR that we make available. We update these reports on an annual basis following each report release. So right now what we have available on our website is for calendar year 2015. So I'm going to switch now to our website, pepperresources.org. I'm going to show you where you can find these reports and what they have in them. So this is the home page of our website, and you'll find the national and state level data on the Data tab. Like the website's moving a little slow this afternoon. And on the Data tab, you'll see that we have a sub-tab for all of the different types of providers that we develop reports for. So I'm going to click on Home Health Agencies here. And this is where you'll find the data reports that we have available for home health. The first report is called the Target Area Analysis for Home Health Agencies. And this report, if you click on this link here, will open up to an Excel workbook that will show you the national level statistics for these 6 areas, the target areas that we've identified as and included in the home health PEPR. So what I've done now is I've opened up this national level report. You can see here that it is for calendar year 2015. There are a little over 12,000 home health agencies in the nation. And then for each of these target areas, we summarize the statistics for the most recent 3 calendar years. So that would be calendar year 2013, calendar year 2014, and calendar year 2015. You may remember in your PEPR, you only see calendar year 2015, the most recent calendar year for your statistics. And so for each of these 6 target areas, we include what we would call the numerator count, the denominator count, and then in this instance, for this target area, this is calculated as a rate. So this is the average rate for all home health agencies in the nation for these 3 calendar years. And I do want to stress that this is the average, so it's not going to be the same statistic as the 80th percentile. The average is going to be calculated as an average of all of the providers, whereas the 80th percentile for the nation is that point below which 80% of the providers' rate or percent falls. So we have these statistics for each of the target areas. Where it is applicable, we also will include the average length of stay for the numerator and the average Medicare reimbursement for the numerator, as well as the total amount of Medicare reimbursement for the numerator. So if I scroll down just a little bit, you can see that we do include these numbers for all of the target areas included in the home health pepper. And these might be a nice reference for you as you are looking through your statistics. It's simply another way that we put together these statistics and make them available for providers if they might be curious or find some way to use these numbers in any way. So that's the national target area summary. The next report you'll see is the top 20 diagnoses report. And this is going to identify the top 20 clinical classification software diagnoses by volume of episodes for all home health agencies in the nation for the most recent calendar year. So you would access that by clicking on the link here. I have it minimized. So this is the national top 20 diagnoses report. For each of these diagnosis categories, we will identify the total number of episodes at a national level in the CCS category, the proportion of episodes to total episodes, the number of visits for that CCS category, and the average number of visits, again, at a national level. Remember, you do have this report in your pepper for your agency as well as for your MAC jurisdiction, and this provides a snapshot for all agencies in the nation. And this is these statistics represent the most recent calendar year, so this would be for calendar year 2015. Okay, back to the website. Let's scroll down a little bit. We also have a national level top therapy report. I'm going to open that one up here. Now again, this is the same format as what you see in your pepper. However, it summarizes the information at a national level for the most recent calendar year. So we do see for each of these 5 therapy categories, that would be early episodes, 0 to 13 therapy visits, early episodes 14 to 19 therapy visits, late episodes 0 to 13 therapy visits, late episodes 14 to 19, and early or late episodes with 20 or more therapy visits. We have these 5 different buckets, we would call them. And for each of those categories, we identify the top 5 CCS diagnosis categories with the number of episodes, the proportion of episodes within each of those groups, the total number of therapy visits for that CCS category, and the average number of therapy visits. And again, for comparison purposes, this might be some information that you could find useful as you look through your pepper, compare your statistics with perhaps the national statistics, or just be nice information to know. Now we also include or analyze these three reports rather at the state level. So you'll see we have the state target area analysis for home health agencies. We have the state top 20 diagnoses, and then the state top therapy report. And these are formatted in the exact same way as the national level report is. The main difference is that when you open the file, you will see one worksheet for each state. And so as you're navigating through the worksheet, you would click on the different worksheet tabs along the bottom of the screen. And I realize now that I increased the view for this first worksheet, Alaska, but I did not increase the view to zoom in for the other worksheets. But you can get a feel for how this report is put together, again, the same way as the national level. But if you're interested in state level statistics, you can go into that worksheet and find your state And so then you'll see the state level statistics for those 6 target areas for the most recent 3 calendar years for your state, and if you're interested in doing any comparisons from that perspective. The state top 20 diagnoses report is also put together the same way, using that same format, one worksheet per state. So you would just simply click on your state. Here is Florida. Again, I apologize for the zoom here on this this worksheet. I didn't zoom in on this, but you get a point that all of these statistics are available at a state level here for the top 20 diagnoses. And then also same thing for the top therapy report, a Microsoft Excel workbook with the different tabs for the different states. Okay, so let me go back to the presentation just for a moment here. We've taken a look at the national and state level data. We also have available on that same page, which I'm going to go back to in a moment, a peer group report. And this actually started out with as a special request from the short-term acute care hospitals who had asked us multiple times for a way to compare their statistics in their PEPR to the group that they would consider to be their peers, whether that would be a small provider, an urban provider, teaching, non-teaching, those types of things. And so we did develop peer group bar charts for the short-term acute care hospitals. And just recently, over the past 6 months or so, we developed them for other types of providers, including home health agencies. And so now, if you're interested, you can compare your PEPR statistics with the group that you consider to be your peer. So what we've done is for each of these 6 target areas, we identify the 20th percentile, the 50th percentile, and the 80th national percentile for home health agencies in 3 different categories. The first category is location. So that would be either urban versus rural. And we identify this information based on the core-based statistical area information from the provider of services file. The second category is ownership type, where we look at profit or physician-owned versus nonprofit or church-owned versus government. And then the third category is simply based on size. So we are stratifying the home health agencies by the number of episodes that they had within the calendar year, the top third, the middle third, and the bottom third. So we're breaking that up into 3 different subcategories there, or groups. So let's take a look at those peer group reports and talk a little bit about how they might be used. So here I am back at our website, still on the home health data page, and at the very bottom you see the peer group bar charts here. So I will click on this file or this link and open up the peer group bar chart. Taking a moment here. Okay, here we go. So now we have a tab for each of the 6 target areas that are included in the home health PEPR. And then we have a bar chart that looks at the categories for each of the subgroups. So for example, this is the target area that looks at average case mix. And so here for total episodes, we can see the different 80th percentiles for the smallest 1/3 group, the middle 1/3 group, and the largest 1/3 group. not a lot of variation for this particular target area. And probably what's going to be most of interest to you will be this 80th percentile category, because that is what we use in the pepper to identify what we call outliers. Then we have the 50th percentile category, again, showing what is the 50th percentile for those three subgroups, and the 20th percentile. We have the same look for location. These are the urban providers, so the 80th percentile for the urban providers versus rural. A little bit of difference there. 50th percentile and 20th percentile, virtually no difference. And then when looking at ownership type, the 80th percentile for the for-profit or physician-owned agencies is somewhat higher than that for the nonprofit church or the government providers. So there is a little bit of variation there. So let's just say you're curious as to how you might use these peer group bar charts. And I have minimized here a sample pepper. This is the same sample pepper that I shared earlier in August. And as you remember, we have these target areas within the pepper that are on the different worksheet tab. And I thought we would take a look at the average case mix, average number of episodes for target area for this particular provider. So when we look at the pepper for this provider, we can see that their target area percent for average number of episodes is well below the national 80th percentile, which is way up here. This is the jurisdiction 80th percentile, and then we have the state 80th percentile. This provider is almost at the state 80th percentile for this particular target area, just above it for this most middle time period. And when we look down here at the comparative data, we can see that the national 80th percentile is 2.78. So you might want to jot that down. As we go back to the peer group bar chart, we're going to see how the national 80th percentile of 2.78 compares with the 80th percentile for the peer group. And our provider has a target area percent of 1.56. I'm sorry, a rate. And these are rates, I apologize. 1.56, which again is much lower than the 80th percentile rate of 2.78. So let's take a look at the bar chart for average number of episodes, which is right here. And so for our provider who had a target area rate of 1.56, they are still well below any of these groups for total number of episodes, the 80th percentile. But you can see there is some variation here. As we look at the location of the provider, again, 1.56 for the provider, which is still quite a bit lower than the 80th percentile for either of these subgroups. And ownership type, there's quite a bit of variation in the 80th percentile. You can see that the 80th percentile for the nonprofit church is 1.66. So if this provider was a nonprofit or church-owned organization, they would still be below the 80th percentile for their particular peer group, but they would be getting much closer. The 80th percentile for government-owned is 2.02, and the for-profit or physician-owned much higher, 2.96. And so these peer group bar charts can help, again, give you more information, breaking down the national level percentiles into these subgroups can give you another way of comparing your statistics and helping you identify if there should be a reason for you to be concerned. I'm going to close this and go back to the website now, there are a couple of other things that I do want to point out. One thing is you might be curious how we put together the peer groups, and there is a methodology peer group document that we have available here that gives you more information on exactly how we developed these peer groups, how we calculated the percentiles, how we identified the location and the ownership type and the size. You might also be curious about what categories your home health agency were identified as being in. And so we have a listing of all of the home health agencies and their peer group classification in this file here. You can use these buttons to sort by provider name or provider number. You can use Control F, as in Frank, to find your name or your provider number in this file, and it will identify, or it will show you how your home health agency is classified in these three areas: if you're rural or urban, if you're government or for-profit or nonprofit, and if you're in the middle, smallest, or largest one-third of providers. Okay, let me go back to my presentation here and just wrap up on the peer group. We do plan, again, to update these annually, and we just covered the methodology and the peer group files for additional details. One thing is, if you disagree with your ownership type or your location as identified in the home health agencies by peer group files, you would need to contact your CMS regional office coordinator to have that updated or corrected. Now, the link that I've included on this slide is specific for hospice, but I'm pretty sure that home health agencies would be able to use the same contact to get their information corrected. We do use the provider of services file, which is available publicly on the CMS website, and it is updated by CMS through the CMS regional offices. And so that's why you'll need to contact your CMS regional office coordinator to make any corrections or additions. So what other references might be handy for you? Let's go back to our website and take a look. So we've gone through everything that's on the Data tab. Let me go back to our home page. And again, this is the home page of our website where we make available right there all the, well, not all, but a lot of resources. For example, the user's guide. We have a link to our training and resources page, to the PEPR distribution, Get Your PEPR page, and there's also a map of the home health PEPR retrievals by state that we update. Before I go to the training and resources, I thought I would just click on this PEPR distribution, Get Your PEPR. Sometimes providers do have a challenge with getting their PEPR. And so we have on this page a table that identifies for all of the different providers when the next PEPR is coming out. So you can see the next home health PEPR is going to be coming out in July. It will summarize the most recent 3 calendar years through calendar year 2016. And then how do you get your PEPR? So you'll get your PEPR by going to the PEPR Resources portal. Before I click on that, I'm going to scroll down just a little bit here. All the home health agencies do receive their PEPR through the PEPR Resources portal. Below the table is some guidance that can help you be successful in accessing your PEPR. There's a little video that I recorded showing how to get your PEPR. We also have an access guide that has step-by-step instructions, and then just some information here that you might want to review before you attempt to get your PEPR. Here's the portal. When you're ready, when you have all the information you need to get your PEPR, you'll click on that PEPR Resources portal. and you'll fill in the fields here to get your pepper. All right, now let me take the opportunity to review the training and resources that we have available for home health agencies. On this page, we also make available the Pepper User's Guide. Under this jurisdictions link, we will identify for you more information about your MAC jurisdiction. And again, sometimes we get questions about the MAC jurisdiction. Essentially, this is the comparison group in the Pepper that's called jurisdiction. And it identifies, or it includes rather, all of the home health agencies that submit their claims to a particular MAC jurisdiction for Medicare reimbursement. Okay, go. I've got too much stuff open here. I need to close some of this. So when you click on the link to access the providers by state and jurisdiction, what you will see for each of the 4 home health hospice MAC jurisdictions is the number of providers that are in that jurisdiction for each state, and then in total. So we can see here J6, National Government Services, has 2,786 home health agencies that submit their claims to it. And so that's the number of providers that are in the MAC jurisdiction comparison group for J6 NGS. And you can see the breakdown of the number of providers by state. We have similar statistics available for Palmetto, 7,066 providers in that comparison group. JK NGS has 350, and J15 CGS has 1,905. And again, you would access that file by clicking on this link right here. We also have a number of recorded training sessions available for you on our website. In July, I did an update on the new release of the Pepper, this Pepper being the second release of the Home Health Pepper. So you can access here. It looks like it's about 54 minutes long. The slides are available, as well as a question and answer document. Some of those you might find helpful or interesting. And I also have some recorded sessions here that I've broken out into the first part of the session, which reviews really the target areas, inclusion, discussion about percentiles, that type of thing. During the second session, I go through a demonstration, Home Health Pepper, and in the third session, talk a little bit more about how the agencies can use Pepper, how it's distributed, and what other resources there are. We also have questions and answers in the slides available. At any time, if you're curious about how a Pepper looks, we always have a sample Pepper available on our website. We have this demonstration Pepper available for all of the different provider types. So if you're curious about other types of providers, you'll find a demonstration Pepper on the training and resources page for those other provider types. And then we have a few other resources here that you may find helpful in using your Pepper. Let's see, one other thing. Let me go ahead and show you the map of Pepper retrievals by state. This is something that we added over the summer, hoping to encourage a little bit of friendly competition between the states so that they will make more effort to access their Pepper. Our goal is to have the home health agencies access and use their Pepper, so we can see that. Let's check on Florida here. Click on the state, and it will show you the number of home health agency Peppers that are available, the 1,044, the number that have actually been retrieved, and then the retrieval rate. And there's also a file that you can click on here that will identify this information in a spreadsheet for all of the states in the nation. And we do update this on a monthly basis, pardon me. So I think that takes care of the additional references that I had planned to review on the website. Of course, if you have questions or need assistance, on our website, pepperresources.org, there is a Help Contact Us link at the top of the page where you can submit a form to request assistance, and a member of our team will get back with you as quickly as possible. And I think now we've got plenty of time to take some questions. Heather?
Great. Thank you so much, Kim. At this time, we'll move into the question and answer session of today's call. If you have a question, please use the chat feature at the bottom right of the screen. We did have a few questions come in during the call, and we can go ahead and answer those while we wait to see if there are any additional questions. The first question is, my pepper does not have any data for the episodes with 5 or 6 visits, high therapy utilization, or outlier payments. What does this mean?
Great question. Let me go back to that sample pepper here. So in the pepper, our contract, rather, with CMS requires that we display the statistics only if the numerator count is greater than 11. And so in this sample pepper here, you can see that the numerator count is less than 0.11. And so that's why there are not going to be any statistics displayed for this time period. It doesn't mean that there's anything wrong with your pepper or that there's been a miscalculation of statistics. It simply means that there were not sufficient statistics to generate or to include the statistics in the report. Same thing, and sometimes we get this question, perhaps in the agency's pepper, they don't have very much in the way of data for either this top diagnoses report or the top therapy report. Like, for example, here you can see there's only one top diagnosis listed for this category of early episodes. And again, there has to be the numerator of 11 in order for us to display the statistics. Otherwise, those are suppressed. Are there any other questions?
We do have a few others that have come in. The next question we have is, am I required to use the pepper?
No, you are not required to use your pepper. The pepper is supplied by us through CMS as an educational tool that can support providers' auditing and monitoring efforts, but you are not required to use it. You're not required to take any action as a result of the statistics in your pepper. However, we do encourage providers to at least access their pepper and take a look, see if there's anything that gives them cause for concern. If the statistics that are reflected there don't feel right, then perhaps there should be some follow-up activities that the provider may wish to conduct, perhaps review some records, look at documentation, check out how the claims are being submitted, and that type of thing.
Great, thank you. The next question we have is, can more than one person in an agency retrieve the pepper information?
Yes, more than one person within an agency can access the pepper. The pepper can be accessed multiple times. We do always encourage providers, once they obtain their pepper through the portal, to save it to a location on their computer so that if they want to look at it again, it's easily accessible and they don't have to go through the validation piece to obtain their pepper again through the portal. But yes, multiple people can access it. There is no limit.
Great, thank you. Can non-providers access pepper reporting in general for statistical gathering purposes?
Non-providers. No, the individual pepper for an agency can only be accessed by that agency. So those peppers are not available publicly. We don't make them available to consultants or law firms or insurance companies or researchers. Now, the national level and the state level data are publicly available, but an individual provider's pepper is not.
Great, thank you. We have one comment that every year they have issues with accessing their pepper. They're able to verify claims in the right time frame, and that 3B on UB04 is correct. After 3 tries, they're blocked, and last year they had to give a private personal email address to have access. Do you have any tips for how they can better access the pepper?
Unfortunately, for the home health agencies, there is something different about the claims that causes more challenges for the home health agencies than for any of the other types of providers that access their pepper. We researched this issue in detail last year when we had coordinated and worked very closely with some agencies who said, you know, this is what I see on my claim form, but yet when we looked at the patient control number or the medical record number that we downloaded from the Medicare claims database, there were some inconsistencies there. Now, we did rule out the possibility that the MAC changes the patient control number. However, we were never able to rule out whether certain billing companies or softwares somehow made that number different. And so one option that we have come up with is possibly using the remittance advice to obtain a patient control number, again, during that time period. And that may be a more successful way to get your pepper. The other thing is, and we recognize that this can be extremely frustrating for busy people who want to get their pepper. And we want to help you get your pepper. So if you're having difficulty, just submit a request for assistance through our help desk, and we will work with you to get your pepper. You know, we want to make sure that you are with the particular organization and that you have the authority to access your pepper. But once we're reasonably comfortable with that fact, we can work with you on that.
Great, thank you so much for that explanation. I'm sure that was really helpful. Are there any other questions that anyone would like to ask? Okay, well, if there are no other questions, I'd like to take this time to thank you all for joining us during today's webinar. I'd also like to thank our presenter, Kim, for sharing her expertise, time, and commitment to making this a successful program. Thank you again for your participation, and I hope you have a wonderful afternoon.
Thank you.